Oh. Oh. Hari Om, and greetings from Niagara Falls. On Wednesday nights, I take our kids to skating lessons, and there's a stoplight before the ice rink, and there's a billboard there that always catches my eyes that shares. 1 in 3 kids, kids meaning they're over 14 years old, 1 in 3 kids who has a mental health condition and they're over 14 years old, they drop out of school. As we look to ourselves and look around, every one of us knows the value of a high school degree, a college degree. Try to visualize what your life would be if you didn't have a college degree, if you didn't have a high school degree. Now, sharing this in a more sacred way, our maps teach us that we all live in a loka. Now, if you go to a Sanskrit dictionary, loka means world. But more fully, loka means field of experience. It is where your experiences happen. More specifically, we live in 2 worlds. One is our outer world. Generally, our experience is what this body goes through. But more authentic and deep, more powerful than that, is our inner world. What thoughts we have, the ideals of the intellect, and so on. There is one more aspect of who we are, and I don't want to describe it as a loka or a field, and that is awareness. It is my awareness that flows through my inner world that creates my outer world. When I am lacking an ideal, that's my inner world, then what happens in my outer world? All affects me then. A push here, a pull here. If my inner world is strong on account of an ideal like service and discipline, then what's happening in the outer world is so different. Now, analyzing our lifestyles more, what do we invest in? What do we make valuable? My reflection is the typical person invests in that which is typical, what is known to them, and that is their outer world. We cook more, we play more, we buy more, we comfort more, but that's not actually what is creating an impact in our loka. It is our inner world. As you think, so you are. And so I am appreciative that our community, through these wellness workshops, engages in LEST. LEST means learn, engage, support, and if we follow through with this, transform. We are learning, engaging, and supporting a shift from investing in our outer world to our inner world. That is that transformation. And if you can visualize this, if our inner world can be made the most idealistic, the most disciplined, we will eventually feel we are awareness. With that, I am happy that this evening's wellness workshop is focusing on understanding mental health care or understanding our inner world. Team?
Hariom Vivekji, Hariom fellow seekers. We are so excited to introduce tonight's speaker. Kamini Ji is an associate professor of psychiatry at Western University, London, Ontario, Canada. She is a consultant psychiatrist at Victoria Hospital and also the medical director and quality improvement lead for adult outpatient mental health services at London Health Science Center. Kamini Ji has been associated with Chinmay Mission since 2011 and is a board member for Chinmay Mission London. And we are so grateful to have her here tonight to speak to us about understanding mental health care and unlearning our inherent biases and how to advocate better mental health for ourselves and others. So thank you so much, Kamini Ji, for being with us tonight and sharing your professional knowledge and experience. And with that, I'll hand it over to Kamini Ji.
Thank you, Deepal and Mukul, for inviting me to the wellness workshop. It's an absolute pleasure to be here to speak on a topic which is very close to my heart. I also want to express my deepest gratitude to Vivekji for creating this community and for all the teachings from Bhagavad Gita, which I feel as a psychiatrist are very protective to our mental health. And I also want to express my personal gratitude to Vivekji. Through all Vivekji's teaching, I have not just grown personally, I've also grown professionally as a psychiatrist. Thank you, Vivekji. So I'll quickly share my screen. And I may not be able to see a lot of you. This workshop is mostly interactive, so there'll be a lot of opportunities to write in chat. I'm told that, muting, unmuting is a little difficult, so we'll probably work through the chat functionality here. Okay. I don't have any conflict of interest to declare. I'm hoping that in terms of learning objectives, by the end of the session, the participants will be able to define mental health and identify when to get help for their mental health needs, understand factors contributing to stigma and strategies to destigmatize mental illness, utilize healthy coping mechanisms and resilience building strategies, and seek support for their mental health when needed. So what is mental health? Now, this is a WHO definition of health. When we were in medical school, we were asked to remember this definition by heart so that even if we were woken up in our sleep, we should be able to blurt it out. So health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So I'd just like you to sort of take a minute to think, what does mental health mean to you? And feel free to write in the chat. Yeah, those are great answers. Sense of ease with my own mind, peace of mind, resilience, ability to maintain. I'm not sure what that means. BALABCR. Balance. Okay. Yes, I think those are great answers. So in terms of mental health, there are two dimensions. So it is definitely absence of mental illness, but is also presence of a well-adjusted personality that contributes effectively to the life of the community. It involves the ability to take responsibility for one's own actions, flexibility, high frustration tolerance, acceptance of uncertainty, and courage to take risks. Now, what are the common mental health disorders among youth, and what could be the contributing factors?
Kamini, would it be helpful if we read out the chat for you?
I think that would be great because, I think
Okay.
I'm not good at managing multiple things.
Happy to. So anxiety, stress and anxiety, peer pressure, social media, comparison, social pressure, family situation, bullying, stress. Those are some of the responses we've gotten.
Great. Yeah. So you got it all. So these are the common mental disorders in youth as per the US Department of Health and Human Services 2019 report. Mood disorders, including depression, is seen in about 13% of youth, and anxiety disorders about 32%. And other common disorders in youth are attention deficit hyperactivity disorder and eating or feeding disorders. I must say that depression and anxiety disorders are the most common mental health conditions seen in all population at this time. So academic pressure, family expectations, societal stigma, they can all contribute to feelings of hopelessness and sadness, contributing to depression. Anxiety disorders commonly present as generalized anxiety, social anxiety, and panic disorder, and they are also often related to academic and career pressures in youth. Substance use, including alcohol and drug addiction. Youth can, use these as coping mechanism with stress and emotional issues, leading to significant worsening in mental health conditions. In terms of eating disorders, anorexia and bulimia, they're becoming more prevalent and related to body image issues and societal expectations. ADHD, historically, we thought that ADHD was a childhood condition, but it is very much seen in adulthood as well, affecting academic and occupational functioning. And challenges with attention, hyperactivity, and impulsivity can impact various aspects of life. Then self-harm and suicidal thoughts are also very common in youth and resulting from the pressure to excel in academics and career, relationship issues, social pressures. Identity and sexual orientation issues are also common now. Exploring one's identity, including sexual orientation and gender identity, can be quite challenging. Discrimination and lack of acceptance may contribute to mental health concerns. Technology and social media can also contribute to mental health concerns. Cyberbullying or social media as such can contribute to mental health issues, including anxiety, depression, and a negative impact on self-esteem and body image. Okay, I'm just wondering, can you identify who these lovely gentlemen are?
Samrat Gandhiji, which I think is
Yes.
on our
Yes.
right.
And Pandit Nehru on the left. I just came
Yes.
across this picture, on the internet, and I was very impressed by, they must be, sharing a joke, they're really chuckling about something, a rare picture, I would say. So what I'll do is, this is quite an interactive session. What I've done is I've created a case lineage just to give you an idea what some of the common presentation of a mental health condition could look like. So I can read it out. Let me first, yeah. So meet Maya, an 18-year-old girl who's living in a suburban city in Canada. She has recently graduated from school and is getting ready to go to university. Maya has been experiencing persistent feelings of sadness, hopelessness, and a lack of interest in activities she once enjoyed. Over the past 6 months, her sleep patterns have been disrupted, and she finds it increasingly challenging to concentrate at work. Maya has withdrawn from social interactions, and her performance at work has been noticeably affected. Maya schedules an appointment with a mental health professional due to her overwhelming feelings of despair and the impact on her daily life. She describes pervasive feelings of worthlessness, a loss of appetite, and lack of energy. Additionally, she acknowledges having recurrent thoughts of death, although she has not made any specific plans. So what do we think is going on here? I can move back. And Lavanya, if you can just read out for me as the chat comes up.
Sure, sure, Kamini. So I see major depression, hormonal depression, suicidal.
Yes, I think that's very right. That's very correct. Now,
Isolation.
I think the reason I put this case vignette is for us to recognize that we all feel, we may feel depressed from time to time in response to an untoward event that has happened. But most of the time, these depressed feelings, they last only for a day or two, or maybe for a few days, but we bounce back. But if we are not able to bounce back, and if these feelings are ongoing for more than 2 weeks, then we must seek, advice and professional opinion to say what is going on. So just to give you an example of, what the diagnostic criteria for a depressive episode are, I don't want to convert you into psychiatrist, but these are the criteria we use in DSM, that is Diagnostic and Statistical Manual of Mental Disorder, which is like the Bible of psychiatry. So DSM says that if there are 5 or more of the symptoms, at least one is depressed mood or loss of interest for 2 weeks. So these could be significant weight loss or gain, insomnia, like you're not able to sleep, or hypersomnia, sleeping too much, psychomotor agitation retardation, that you're feeling agitated in your mind and your body, or you're too slow in your mind or body for no reason, you're feeling too fatigued, worthless or inappropriate guilt, poor concentration or indecisiveness, developing suicidal thoughts or plan. And all of these symptoms are causing significant distress or impairment in your day-to-day functioning. And you are not drinking too much alcohol or using cannabis, or there's no other medical condition which is contributing these symptoms. So if any of these, 5 or more are present for 2 weeks or longer, then that could be actually diagnosed as a depressive episode, and we should go and seek help. I'll present one more case vignette. So meet Rahul, who's a 21-year-old third-year health sciences student at TMU. Rahul has always been diligent and conscientious, earning accolades at school. Recently, however, he finds himself grappling with persistent and overwhelming feelings of anxiety. It all began when he scored low marks at midterms, triggering an intense fear of failure. Rahul experiences a constant sense of apprehension, particularly related to school performance and meeting expectations. He often spends hours ruminating about potential negative outcomes. Sleep disturbances have become routine, with frequent episodes of restlessness and difficulty falling asleep. Rahul's concentration at school is compromised, and he has started avoiding social gatherings, fearing judgment from peers. So I think it won't be a surprise if you say it's anxiety disorder, and of course it's an anxiety disorder that Rahul is experiencing. Again, I would like to highlight that, feeling a little bit anxious in certain situations is normal. Fright or flight is a normal survival response. But if we observe that these feelings of anxiety, they may start from a particular event or a trigger, but if they are ongoing and they're continuously affecting our level of functioning, then we must go and get help. Now, again, if we look at the criteria for a generalized anxiety disorder, which means excessive anxiety and worry most days lasting at least 6 months about a number of events, not just one event, finding it difficult to control this worry, and associated with 3 or more of these symptoms, including restlessness, feeling on edge, easily fatigued, poor concentration, irritability, muscle tension, sleep disturbance. And anxiety is not confined to any one specific stimulus, and it is causing significant distress or impairment. And of course, we rule out any other substance use or medical condition, then that could be a generalized anxiety disorder. Okay, so moving on, let's spend some time on stigma. So I would like you to sort of express your thoughts about what do you understand by stigma, and what can we do to destigmatize mental illness?
Kamini, just one question in the chat before we move forward. That was really important is what do we do by the time we get to meet a professional due to the long waiting list Do you have any suggestions for, what to do while I wait to get connected to a professional, to seek help?
Right, that's a very good question, and that's a very common reality in North America. I would say that if you're waiting to see a physician, like a psychiatrist, yes, there could be long wait period. But in the meantime, you could look for a psychologist, maybe for talk therapy. And I would, talk about other things which may be available just later in my presentation. So if we can wait a few more minutes, it's coming up.
So, Kamini G, we have some responses to stigma. So I see stigma is those who, sorry, my chat is going. Those who have not suffered tend to assume you can just change your mind or that it's not a real disease. The fix would be talking about it. I see Shreya said there is stigma about facing mental health illnesses in the workplace, especially if you are a woman or person of color who has had to fight other prejudices to get there. You may not want to look weak or ask for help. Stigma is a social perception of something that makes people avoid that topic. So we need to dismantle this to educate people in the topic and help them understand. People do not understand what you're going through and take it lightly or laugh it off. So some really good feedback in the chat.
Yeah, great. So yes, that's all covered. So stigma is a social phenomenon that involves the creation of negative attitudes, beliefs, and stereotypes about a particular group of people. It leads to discrimination, bias, negative perceptions. Stigma can manifest at various levels, including interpersonal, institutional, and structural, and often leads to social exclusion, prejudice, and barriers to accessing adequate mental health care. Now, there could be various factors contributing to stigma. The foremost is limited awareness and education about mental health. Cultural and religious beliefs, they can contribute to lack of understanding and acceptance of mental health concerns. Mental illness can be perceived as a sign of weakness, as you just mentioned. Now, the religious beliefs sometimes, that mental health conditions are a test of faith, or they are as a result of past life actions or spiritual failings, or mental health challenges could be due to supernatural forces. I think we've all heard our grandparents saying that, these are the result of a past life karmas, ye pichle janmo ke karmo ka phal hai. But, I would say that, as we've learned in Vedanta, everything that we are facing in this life is, in fact, a result of our past karmas. But that doesn't mean that we don't go and get help. If we have a medical condition like diabetes or high blood pressure, or if I break my foot, do I not go to get help from a physician or from the hospital? And why do we hesitate to get help for mental illness? It is also a very biological condition, a very medical condition that needs as much attention as any other medical condition. So various factors, contribute to stigma: social expectations regarding behavior, achievement, and conformity. Individuals deviating from these expectations due to mental health challenges might fear judgment, rejection, or discrimination. Family honor, mental health challenges might be seen as a reflection of family honor, and individuals may fear bringing shame to their families, leading to secrecy and reluctance to seek help. Media influence, media portrayal of mental health issues can reinforce stereotypes and contribute to stigma. Misrepresenting mental health conditions in the media can also perpetuate the negative attitudes. So what can we do to destigmatize mental health? Why do you think I put a picture of Narendra Modi here? So I think one good thing that Modi ji has done is that he has brought India to the world map. I think world probably knows better about what Indian culture is, what India is all about. And that is exactly what we need to do about mental health. We need to make everybody aware of what mental health is. So mental health stigma can be addressed via multifaceted efforts, awareness campaigns, sessions like these, education regarding treatability of mental illness, fostering open conversations challenging stereotypes, creating supportive environments to promote mental health and well-being. So these are all some of the strategies that we can use to address mental health stigma. Now, one thing which is very important to understand is the etiology of mental disorders. Where are mental disorders coming from? When I see a patient in my clinic, a new consultation, and when I consider that, yes, there is a diagnosis here, a depression, psychosis, or bipolar disorder, I don't just give the diagnosis to the patient. I do discuss a full formulation, and it's called a biopsychosocial spiritual formulation. What that means is that what are the various factors, predisposing factors, perpetuating factors, precipitating factors, which are contributing to the presence of this individual presenting the individual presenting to our clinic today. So, for example, biologically, if somebody has a family history of a mental health condition, they are more vulnerable, genetically more vulnerable to develop a mental health concern later in life. Using alcohol, cannabis, amphetamines, all of these substances can contribute to specific kind of mental illnesses. Any medical condition, for example, heart disease, diabetes, these can also be associated with mental health condition. Psychological factors, if somebody has had psychological trauma growing up, for example, recurrent physical, emotional, or sexual abuse, that definitely makes them more vulnerable to develop a mental illness later in life. Social factors, poverty, or any current, serious untoward event, for example, losing your job, losing a relationship, losing a loved one. So any of those factors can contribute to mental illness. And also, being spiritual or having faith is a very protective factor against mental illness. So we describe, the role of nature versus nurture, gene versus environment in contributing to the origin of mental illness. And I must say that every person has a lot of protective factors as well, which we focus on. And in spite of, I've had so many patients in my clinic, in spite of having gone through a very abusive childhood, they still are very resilient and they're still functioning pretty well. So there is definitely, a protective factor there. Now, neuroplasticity, it is a phenomenon that actually explains to some extent the biological nature of a mental illness. So neuroplasticity is the brain's ability to change and adapt structurally and functionally in response to experience or injury. So a lot of research has been done that indicates that individuals who undergone chronic abuse, like emotional, physical, or sexual abuse, their brain adapts by changing structurally and functionally to that environment. And that indicates that because there is a change in the brain, that means a very biological condition, and it is very treatable by using medications or by using talk therapy, which may need a little bit longer duration of time. And this is just, I put a slide there that there is research to confirm that there could be deficiency of one of these neurochemicals in the brain contributing to depression. So norepinephrine, serotonin, dopamine. So the bottom line is that mental disorders are very treatable. We can use both pharmacotherapy and psychotherapy as treatment options. Often, I see individuals in my clinic who have been treated before for their mental health condition with a medication and they stop taking it. They have another episode, they get the medication, they get better, then they again stop taking it. So I kind of ask them, why are you stopping your medication that's working well for you? And they come up and say, why do I need a medication? Why can't I just do it myself? And that is when, I spend some time, using the analogy of a medical condition like diabetes or hypertension, that if you have diabetes and, your doctor tells you that your pancreas is not secreting enough insulin and you do need insulin replacement, would you not go for an insulin replacement therapy? Would you actually say, okay, let me just try harder and my pancreas can secrete more insulin? And mental health condition is very biological. If there is any deficiency of any neurochemical and a medication can balance it out, why not take that medication? Okay, so we will spend a few minutes on how do we maintain our mental well-being, and what are some of the healthy coping mechanisms and resilience building strategies? I must say that, this community is very much protected because of all the teachings that we've got from Vivekji. They themselves are very protective against any mental illness. But still, I would like you to, suggest what comes to your mind, what we should do day to day just to maintain our mental well-being.
Priyam, we have satsang gratitude journaling.
Great. I think some of the most common things we forget. I actually came across this, this image on the internet when you're looking for a theme, and this actually summarizes it all. Slow down, keep calm, be positive, take it easy, unplug, enjoy life, have fun, breathe, relax, go outside in nature, smile, meditate. All of this helps, to keep our mental health stable. Healthy lifestyle, people sometimes underestimate the importance of adequate sleep and nutritious diet, physical exercise. And these are the first things we recommend to all our patients, who are going through a mental health concern, that they must focus on their sleep, their diet, going out in nature, doing regular exercise, yoga, breathing techniques. All of these, they help with depression and anxiety, and there's research behind it. These are a list of self-management strategies that I personally provide to all my patients. And they have these links, that they can just click on and find some more information on. Mindfulness and meditation. It's interesting that, if you Google 10 best free meditation apps of 2023, you can come out with a number of apps which are free, which you can download. It's ironical that, Vivekji's highest vocation is not in there yet. Building social support for oneself, setting clear boundaries, learning to say no when it's enough, positive self-talk, cultural and creative outlets, seeking professional support, spirituality. There's lots and lots of research that indicates that people who are spiritual, who have faith, they not only have less mental illness, they have less illness as such. So people who have faith, they live longer as compared to people who don't. I must say that Canada is a little bit backwards in terms of understanding the importance of spirituality and mental health. If you go to the Royal College of Psychiatrists website, I trained in UK, so I kind of visit their website all the time. There's a special interest group on spirituality. That means there are psychiatrists, who are interested and who do inquire about, the spiritual well-being of their patients. I must say that in our psychiatry residency training program, I do teach my residents. We do have a module on cultural psychiatry, but in this module, there was no session on spirituality and mental health. And I've been advocating for 3 years that we should introduce, and I'm glad that this year, for the first time, I'm going to take a session on spirituality and mental health, which is a 2-hour session for our third-year residents. And this just emphasizes how important it is for the psychiatrist and mental health professionals to understand the role of spirituality, because it is very, very protective, and I can assure from my own personal experience. Now, this is a serenity prayer that a patient of mine actually shared with me, and I find it is so practical. It's so full of Vedanta. God grant me the serenity to accept the things I cannot change. I think that's their bhakti yoga, just surrender to Bhagwan. The courage to change the things I can, that is, I think, is karma yoga, and the wisdom to know the difference, that is jnana yoga. That, so that we can discriminate between what is real, what's unreal. And I often use, this is a very practical prayer and very relatable to a lot of my patients. So I do share with them a lot of time. I quote Gurudev, this is the best quote that I use, not only with my patients, also with my colleagues, and in particular with my secretary. I must say that we have a very busy clinic, and I work in an acute hospital. There are lots of emails, faxes, phone calls, phone messages, which can be very distressing, that come every day. and my secretary, she gets the brunt of it, and she gets very anxious, overwhelmed. And I actually, in the morning, first thing we say, okay, breathe and let us do our best and leave the rest. So she actually has this quote on her desk now, so that we can deal with, any crisis that comes our way. This is another one that I often share with my patients. Instead of telling God how big your problems are, tell your problem how big your God is. I must say that I can only, share spiritual quotes or spiritual discussions with those patients who do show an interest in spirituality or faith, because a lot of time, I gently ask them, do they feel that faith has a role in their life? And if they say yes, then I would definitely go into it and we'll talk more about it. But there are times when people shut down and they say, no, I don't believe in God and faith has no role. And that is where I have to back out. And that could be, a struggle sometimes. Okay, so this is the last bit. So what supports, are available locally? This is the time, when I request all the participants to actually use their cell phones and Google and figure out, what mental health supports are actually available locally in their area. I think the resources I have here are very much local, related to London. So there's always a crisis line or a crisis web chat in every region in Canada, and I'm sure in America as well. There are community counseling agencies available that we can consult. If you are looking for a private therapist, there are various websites through which we can search a therapist. And, if we have benefits coverage through work, then it is, easier to find a private therapist, less wait period as compared to the public sector. Then in Canada, there is something called Canadian Mental Health Association, CMHA, which is present in most of the provinces of Canada. And they have a lot of resources available. There is an LGBTQ plus healthcare directory as well. And there are a lot of mental health online resources and self-help books. So what we do, and I totally understand the question that was asked about the wait periods. So when we get our referrals, and if suppose for a non-urgent referral, our wait period is 3 to 4 months, then our admin staff, they contact the patient and they pass. We've developed a list of online self-help and other community resources, and we pass that list to all our patients while they're waiting to see a psychiatrist. So that is what I would recommend. But of course, if you are looking for professional help, yes, these are the sources. But outside of professional help, if you have a community that you trust, something like here, or you have a friend or a family member that you can trust, I would suggest go and talk to them and see if that helps to an extent. And of course, hospital is a last resort. We have outpatient as well as inpatient services there. So I'll just summarize that good mental health is pivotal to one's ability to realize their full potential and cope with the ups and downs of life. Comprehensive and holistic approaches are needed to identify and address mental health challenges. These include awareness, healthy coping strategies, education and destigmatization, and accessible mental health support services. Thank you.
Awesome. Hariam, Kamini, thank you very much for the wonderful presentation. I know I took away a lot from it, and I sure saw lots of people had wonderful things to say and great questions.